Infancy, childhood, adolescence, and adulthood. These are the growing years. But every time the capability of the body increases, so does its usage. These activities has an impact on the musculoskeletal system of the human being. Constant activity results in the destruction of the joint cartilage that cushions bones and prevents them from grinding against each other. But what causes this wear and tear? The human body has inherent powers of restoration. This ensures that the damage that is done to the cartilage and joints are automatically repaired and restored. But as one reaches the mid-40s, the body's restorative powers diminish. This results in a steady rate of wear and tear, concurrent to diminishing restoration. The result is pain, stiffness of the joints, and inflammation. This condition marks the onset of osteoarthritis. To understand the pathophysiology of pain and inflammation in the joints, it is necessary to understand the basic building block of life, the cell. Fatty acids such as omega-3 and omega-6 are an important part of the cell membrane and perform two primary functions. Firstly, they are structural components of the cell membrane, where they ensure fluidity, stability, and act as gatekeepers in the cell. Secondly, both omega-6 and omega-3 fatty acids are converted into a number of important active molecules called prostaglandins. Of the different prostaglandins, PGE2 are pro-inflammatory, whereas PGE1 and PGE3 are less inflammatory in nature. The type of prostaglandins and inflammatory mediators produced are dependent on the ratio of omega-3 to omega-6 fatty acids in our body. Wear and tear of the joint cartilage, along with changing dietary habits over the years, causes imbalance in the ratio of omega-3 to omega-6. Further, due to increased intake of omega-6 fatty acids, the body converts omega-6 fatty acids into arachidonic acid. COX-2 plays a critical role in converting this arachidonic acid to hormones like prostaglandin PGE2, leukotriene B4, and the cytokines interleukin-1, IL-1, and tumor necrosis factor alpha, TNF-alpha. All of these promote inflammation. In addition, IL-1 and TNF-alpha trigger the production of free radicals, which encourage the production of more pro-inflammatory cytokines. The pro-inflammatory reaction essentially feeds on itself, setting the stage for chronic inflammation. This continuous inflammation results in a full-blown case of osteoarthritis. Therapy at this stage should facilitate easy movement and alleviate the pain, inflammation, and stiffness in the joints, thus allowing the patient to live a relatively normal life. NSAIDs have always been the universally recommended therapy for patients suffering from osteoarthritis. The action of NSAIDs controls the symptoms, but does nothing to diminish free radicals, which continue to cause damage. Given the fact that treatment of osteoarthritis is normally long-term in duration, the side effects of sustained administration of NSAIDs is also a concern. An added factor of concern is the fact that as the disease progresses, medical practitioners are often compelled to increase the dosage of NSAIDs for therapeutic efficacy. A comparison of prehistoric lifestyles with modern ones brings into focus an interesting contradiction. Assuming that wear and tear is one of the major causes of osteoarthritis, it is easy to presume that prehistoric man would be more prone to osteoarthritis. Prehistoric lifestyles demanded a lot more in terms of physical action. Yet there is little physical evidence to prove that prehistoric man suffered from osteoarthritis. The comparison of the dietary intake of prehistoric man and modern man has brought startling conclusions to light. Dr. Brad Rackman, Director, Department of Medical Science, GSDL, USA, in his exhaustive study on dietary habits through the ages, concludes that prehistoric man had dietary habits which balanced omega-6 and omega-3 in the ratio of 1:1. By the early 1900s though, the changing dietary habits skewed this ratio to 4:1 in favor of omega-6. Today, the current omega-6 to omega-3 ratio in terms of our diet is a staggering 45:1. Omega-3 fatty acids are a form of fatty acid that our body derives from food. Studies have revealed that omega-3 fatty acids lessen the inflammation due to their ability to get converted into less inflammatory prostaglandins. When the amount of omega-3 fatty acids in the diet is increased, its metabolites, primarily EPA and DHA, will compete with arachidonic acid for use of the same enzymes. In this way, more omega-3 fatty acids leads not only to an increase in less inflammatory mediators, but also to a decrease in pro-inflammatory mediators, thereby significantly reducing the ratio of pro-inflammatory to less inflammatory mediators. Therefore, a balance of omega-6 and omega-3 fatty acids are essential for good health. After having understood in detail the pathophysiology of pain and inflammation, let us see how omega-3 helps in alleviating this condition. As standalone therapy, NSAIDs have their own limitations, especially gastric side effects, including gastric ulcers, peripheral edema, and other allergic reactions. Co-administration of omega-3 along with antioxidants is recommended, as it improves the symptoms, reduces NSAID usage, and thus the side effects of long-term administration of NSAIDs. Various international journals such as Lipids 1996, Journal of Rheumatology 2000, Journal of American College of Nutrition 2002, Journal of Human Nutrition and Dietetics 2003, and various other clinical studies have demonstrated time and again the ability of omega-3 fatty acids to gradually reduce the required usage of NSAIDs. This in turn reduces the side effects of long-term NSAID administration. Thus, since arthritis is predominantly associated with inflammation and free radicals, supplementation with omega-3 fatty acids and antioxidants can serve as an effective complementary treatment along with NSAIDs. To sum up, omega-3 fatty acids can indeed be described as the nutrient for winning fitness in arthritis.